We're diving into the immunohistochemistry MUM1 test. This test is crucial for diagnosing certain types of cancers and understanding the cellular makeup of specific diseases. So, let's get started. Pre-test information. Before performing the MUM1 test, there are some important pre-test requirements to keep in mind. Firstly, it's essential to provide a copy of the patient's histopathology report. This report offers critical insights into the tissue sample's cellular structure and pathology. Additionally, information about the biopsy site and the patient's clinical history is necessary. These details help pathologists understand the context of the tissue sample and ensure accurate test interpretation. Specification of the test. So, what exactly does the MUM1 test do? MUM1, or multiple myeloma oncogene 1, is a protein expressed in the later stages of B-cell differentiation and activated T cells. This means that MUM1 plays a role in the immune system, specifically within plasma cells and certain T cells. By identifying the presence of MUM1, pathologists can determine if the cells are progressing normally or if there's an underlying issue, such as a neoplasm. Diseases associated with MUM1. MUM1 expression is primarily seen in specific types of cancers. These include plasma cell myeloma and Extraosseous plasmacytomas, which are cancers derived from plasma cells. Additionally, MUM1 expression is observed in some non-hematolymphoid neoplasms, particularly in melanomas. Understanding which cancers are associated with MUM1 helps doctors pinpoint the origin of a malignancy and determine the best course of treatment. Specimen used. For the MUM1 test, the specimen typically used is a tissue sample obtained via biopsy. This could be from various sites depending on where the disease is suspected. The tissue is then processed and prepared on slides for microscopic examination, allowing for precise identification of MUM1 expression in the cells. Components included in the test. The MUM1 test involves several components, including specific antibodies that bind to the MUM1 protein in the tissue sample. These antibodies are tagged with markers that make them visible under a microscope. When the antibodies bind to MUM1, it indicates the presence and extent of the protein, helping to identify abnormal cell growth. Test report time. Once the sample is collected and processed, it typically takes about 7 days to get the test results. This time frame allows for the tissue to be adequately prepared, stained, and analyzed by a pathologist to provide a comprehensive report. To sum up, the MUM1 test is a valuable tool in diagnosing lympho-hemopoietic neoplasms and certain types of cancers, like plasma cell myeloma and melanomas. Its ability to identify abnormal cells based on MUM1 expression helps in making a precise diagnosis and planning effective treatment strategies.